Hi there, my name is Lane Sanderson and I'm the Principal Podiatrist at the Subiaco Foot Clinic. And today I'm going to talk to you about one of the more common things that we see in our clinic, which is called plantar heel pain or plantar fasciitis, as you may know it by. If you ever suffer from this problem, you'd know it can be incredibly debilitating and often really difficult to shake. But the good news is that it's very, very treatable. So over the next few weeks, I'm going to be posting up a series of videos of things that you can do at home to try and fix this problem. But of course, if you're not getting any response, please don't suffer in silence, because as I said, it's something that we treat every week, and I would encourage you to go and see your local health professional. Please enjoy.
So I like to break my plantar heel pain patients into those in the pain dominant phase and those in the load dominant phase. Patients in the pain dominant phase, they're usually getting pain as soon as they get out of bed in the morning, and it's carrying on throughout the day as well. They usually hobble in, they're absolutely miserable, and our number one goal is to get them out of pain as soon as we can so they can get back into life. Now, a great way to do this is to release those tight structures around the heel that are pulling on the aggravated area. Now, we do this ourselves with deep tissue massage and dry needling, but it can definitely be helped along at home as well. And we'll just go over a few exercises that we encourage all our patients to do. So the first exercise, as you can see here, uses a lacrosse ball, and we're working on those structures on the underside of the foot. So we start with the lacrosse ball on the outside of the foot, just behind the little toe, and we're rolling from the outside of the foot all the way into that juicy part behind the big toe. Now we're taking 3 segments all the way from behind the 5th toe down to the heel, and we're standing up so we can put a little bit of weight into it if we need to. Now what we're not doing is we're avoiding that heel so that we don't re-aggravate the area and set back our recovery. So the other structure that we want to release is the back of the calf. In my experience, almost all patients who have plantar heel pain have some level of calf tightness or weakness. And so we go about releasing that structure at home using a foam roller, as you can see here. So we're actually going across the tendon, much like the bottom of the foot. So you position one leg over the roller and your other leg on that leg to add some weight. And essentially you roll outside and then in, taking about 10 seconds per segment, starting at the back of the heel and working your way up to the back of the leg. And once you've finished all of these segments, I would certainly go and do the other leg, even if it's not painful, and that goes for the ball as well. So run through both these exercises 3 times, and that'll go a long way into releasing these structures and getting you out of pain as soon as possible.